This video will show you how to inject yourself with your Gonal-f pre-filled pen. It contains all the instructions for use. Before using your pen for the first time, please watch the video all the way through. Step 1. Getting ready. Wash your hands. Make sure you have all the necessary items before you begin. This should include the Gonal-f pre-filled pen, one needle, and alcohol swabs. Before you begin, take a moment to examine the pen and the medication. The pen must be at room temperature and the medication in the pen should be clear. If it is not clear, or if the medication contains particles, do not use it. Instead, call your doctor, nurse, or pharmacist. Attaching the needle. Remove the pen cap. Remove the peel-off seal from the outer needle cap. Attach the needle by pressing the threaded tip of the pen into the outer needle cap. Screw it until it is firmly locked in place. Remove the outer needle cap. Removing air bubbles. Follow these steps whenever you see large air bubbles inside the drug reservoir. Look carefully at the drug reservoir. If you don't notice any large air bubbles, the pre-filled pen is ready for use. If this is the case, move straight to Step 2, setting the dose. To remove a large air bubble, set the dose setting knob to 25 units. Remove the inner needle cap. Hold the pen with the needle pointing upwards. Gently tap on the drug reservoir to allow the large air bubble to rise to the top. It is normal for a few small air bubbles to remain. Keeping the needle pointing upwards, push the dose setting knob in completely. A small drop of liquid should appear at the needle tip. This means that the large bubbles have been removed and the pen is ready to use. Step 2. Setting the dose. If you have not yet done so, remove the inner cap of the needle. Turn the dose setting knob until your prescribed dose appears in the dose window on the side of the pen. Please do not push or pull the dose setting knob while you turn it. Always check that the number showing in the dose window corresponds with the correct dose that your healthcare provider has prescribed for you. If the dose you dialed is too high or too low, turn the dose setting knob again in any direction until the number showing in the dose window is the dose that you are prescribed. Step 3. Inject. Your healthcare provider will have discussed suitable injection sites with you. To minimise discomfort, it is best to select a different injection site each day. Clean the recommended injection site with an alcohol swab and let it air dry. Then, hold the pen with one hand and with your other hand pinch the skin around the injection site as instructed by your healthcare provider. Insert the needle into your skin. Once you have inserted the needle, you can release the skin. Push the dose setting knob right to the end. With your finger still pressing the dose setting knob, keep the needle in the skin for 10 seconds. After 10 seconds, still keeping the dose setting knob pressed down, take the needle out of the skin. Apply pressure on the injection site. Make sure you have given yourself a complete injection. Check that the dose window shows 0. This will confirm that the dose has been delivered completely. Caution: if the dose display shows a number higher than 0, this indicates that the pre-filled pen is empty and the complete dose has not been given. If this happens, the number in the dose display will indicate the missing amount of Gonal-f solution to complete your dose. This is the dose you need to inject using a new pre-filled pen. To complete your dose, follow the steps described previously from getting ready through to setting the dose. Set the dose on the new pen to the exact number displayed on the dose window of the empty pen that you just used, and inject this amount. Post-injection. Remember to take the needle off the pen after each injection. Hold the pre-filled pen firmly and carefully put the outer needle cap back onto the needle. Please be careful not to prick yourself with the needle. Once you have done this, grip the outer needle cap and unscrew the needle. Do this by turning it counterclockwise. Dispose of the used needle safely. Ask your healthcare provider how to dispose of needles that are no longer required. Now, put the pen cap back onto the pen. Please remember never to reuse any used needles. Also, never share needles. Caution: always remove the needle from the pre-filled pen before putting the pen cap back on. The pen cap cannot fit over the pre-filled pen with a needle still attached. Never store the pen with the needle still attached. Storing the Gonal-f pen. Once the needle has been removed, store the pen in its original packaging. When the pen is empty, ask your healthcare provider how best to dispose of medicines and needles that are no longer required. Thank you for watching this video. If you have any other questions about how to use your Gonal-f pre-filled pen, please ask your doctor or nurse for advice.